Welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, we've got an important healthcare update that you won't want to miss, but first, John Micek and Karen Langley, two of the state's leading reporters, they're in the House. We're going to talk about what happened to the Lieutenant Governor Mike Stack this week. We'll fill you in on that after these words.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, the Lieutenant Governor of the state of Pennsylvania had to issue an apology for things that he, I guess, did and said. This is unprecedented in this state. Joining me to talk about that and more is John Micek. He's the Editorial Page Editor of the Patriot News PennLive, and Karen Langley. She covers the state capitol for the Pittsburgh Post-Gazette. Karen, let's start with you. First of all, to my knowledge, I know of any governor who, in modern history, I won't go back into the 18th century. John's smiling here about that. He's written a lot about the past. A governor asking the Inspector General to investigate the activities of his own lieutenant governor. So briefly, tell us what was he said to do?
So it's a very intriguing situation, as you said. A few days ago, news reports came out reporting that the state inspector general, which is part of the governor's administration, was looking into claims that the lieutenant governor, Mike Stack, and his wife were not treating the household staff at their state-provided residence and to the state troopers who protect them well, that they were, speaking badly to them. That word was used. Yeah. And also that Governor Wolf had a role in instructing this investigation to happen. The information kind of, came out. The Lieutenant Governor's office confirmed the investigation, but wouldn't say any more about it. And then a day or two later, the Lieutenant Governor called a press conference and said that he had sometimes spoken in anger to the people around him, but that he respected them so much and that he apologized.
They're like family, didn't he say?
He did say that.
Yeah, John. Yeah. So let's pick this up. I don't see in the reports that you all have written about, I've not seen anything that looks like a violation of the law. Perhaps telling state troopers that drive, the vehicles for them, that they should put the whatever they are on the lights on the, and maybe the sirens, and that's against, violates the motor vehicle code. But at heart, what do you think's going on here?
Well, I mean, who among us hasn't popped off at our personal security?
We all have.
The guys charged with maybe taking a bullet for us. I mean, it's a spectacular lapse of judgment, if nothing else. I mean, there's nothing illegal about being rude and obnoxious, but I mean, it's pretty extraordinary behavior. And as Karen correctly points out, it's pretty amazing that Governor Wolf had apparently directed the IG, Bruce Beamer, to open this probe to begin with. The press conference itself was surreal. Stack had said that he'd spoken out in anger, that he had, quote, Stack moments, launching 1,000 hashtags, no doubt right there, but never said, under repeated questioning, what it was that was he or Mrs. Stack, Tonya Stack, his wife, had said that was so bad that had prompted this probe to begin with.
I must tell you, I've never, governors and lieutenant governors have sometimes have had close relationships and sometimes not. Catherine Baker Knoll, God bless her, was, a wonderful person, but Ed Rendell had virtually nothing to do with her. By that, I mean giving her assignments. Stack has gotten, can either of you name a major assignment that he has gotten? I can't think of one. You know what I mean? The lieutenant governor has statutory and constitutional responsibilities, but governors also give them big things. Is there any relationship that you can see? Much in the way?
I can't think of any assignment from the governor to Lieutenant Governor Stack. One moment that struck me during the press conference with Lieutenant Governor was when he was asked if he had spoken with Governor Wolf about this situation, and one of the things he said was that the last time he and the governor had even spoken was a few weeks ago. and they're not said to be close, but I thought that was interesting that it's been weeks since they've even spoken.
Yeah, I mean, my phone buzzed not long after that happened, and it was a copy of the governor's public schedule. It looks like the last time these guys were in a room together was March the 17th. So we're getting nigh on a month here. What's laid bare is the fact that these guys aren't tight at all. I mean, you saw Jim Cawley and Tom Corbett, who kind of like had a Skipper and Gilligan sort of relationship. Tom Ridge gave Mark Schweiker a lot to do on PEMA because Schweiker had that emergency management experience as a county commissioner. Stack talked a bit this week about the stuff he's done with the Pardons Board and how he's tried to really make that more prominent. But that's a statutory role for the LG's office. But apart from that, you're right. I mean, LGs only have as much clout as their boss is willing to give them.
All right, we're going to run to a break. When we come back, I want to finish up a discussion about this, and then I want to talk. We can talk a little bit about property taxes or pensions. The legislature is on a break. They have a break slightly longer than most colleges and universities, but I won't go there. I'll get us all into trouble. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania State Education Association and Partners for Public Education, bringing the power of a great education to our schools, our students, and our communities. This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Highway Information Association, the go-to source to learn about transportation projects and issues. Please visit pahighwayinfo.org. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Welcome back. I'm chatting with Karen Langley and John Micek, reporters who have covered. John's now an editor at his paper, reporters who have covered the state capitol for many years. We're discussing the situation with the lieutenant governor of the state who is under investigation by the inspector general for, I'll say, lapses in judgment. At least that's what the allegation is, that they maybe screamed and shouted, is that right, at their staff. They out at Indiantown Gap, right, where they have a home provided by the state, and among other things. All right, Karen, as you know, in the primaries that take place for governor and lieutenant governor, and that will be next year, the lieutenant governor and the governor run separately. Okay, whoever wins the primary moves on, and then they're linked together as a team. Is there any indication, A, that Stack is going to run, and B, we'll have to see what the report shows, that Governor Wolf doesn't find someone else, quote, to run with him, end quote?
Well, so the lieutenant governor says that he's in. That's what he told reporters, that he expects that running. He and the governor are going to be running again. But this issue is one of the things that makes this whole episode more interesting. It's not just the allegation itself of perhaps yelling at workers, but the political implication if these are two politicians who aren't close to begin with, and now we're looking at a re-election campaign coming up.
Yeah, that's exactly right, John. There's another aspect of this. I mean, the governor could find someone to run. It's not common that gubernatorial candidates pick a lieutenant gubernatorial candidate, but Tom Ridge picked Mark Schweiker, at least when Mark was running.
That's right.
He was a Bucks County commissioner, and they, in a sense, ran as a team, even though they were disconnected on the ballot. The question here is, why would the governor not handle this quietly? Why didn't he just call the lieutenant governor in?
That's a fantastic question, and one well worth asking. I mean, we did see this back in 2004, Terry, I'll remind you, with Catherine Baker Nolan at Rendell, when she was the subject of a number of gaffes, and there were rumors floating around that maybe Rendell was going to jettison her and run up to the 2006. I mean, it turned out to be much more of a political liability because she was still monstrously popular out in western Pennsylvania and was an important geographic balance. And that's what this is going to go to. The Wolf people will look at the naked political calculus of this and weigh whether trying to get somebody new will help them in what's going to be a tough re-elect, or if keeping Stack on board is going to be the better option.
Well, we're going to follow this, but John, while you have the floor here for a minute,
I will yield back the balance of my time.
You yield back. You've written a lot about, as Karen has, the property tax. We're looking at $11 to $12 billion in order to eliminate it. And there are folks in the legislature that you all have covered who want to eliminate it. We would be talking about the biggest tax shift in the history of the state. Income and sales taxes would rise almost exponentially. Does that look feasible? And I'll ask both of you to weigh in on that. I'll start with you, John.
Well, I mean, if it was going to happen, one would think it would have happened already. Yeah. I mean, that's the rub. Republicans hate tax increases unless it comes to this kind of tax shift that you're talking about. It'd be like 4.95 from 3.07 on the income tax. The sales tax would go from 6 to 7% in most parts of the state, and then 7 to 8% or 8 to 9% in Philly and Allegheny County. Yep. And they'd be expanding the base and the number of items that were covered by it. And even then, there's no guarantee that you get to the $12 billion in revenue that you need to cover the property tax reform.
I mean, imagine you live in Philadelphia and you would pay a 9% sales tax. How many different ways can you say Delaware?
Oh, yeah.
Am I right, Karen? Now, you cover in a different part of the state, but go ahead.
I was just going to say that
West Virginia.
This is like one of the most complicated type of proposals to make that just would affect everyone in the state, that would raise a lot of taxes, as John just said, and that's a really difficult thing to get through the legislature. There'd be a lot of kicking and screaming along the way if it were to get done at some point.
John, the other thorny problem is what to do about what now has been estimated as $70 to $74 billion pension debt for the two big state pension systems. They don't seem to be on the same page again to do something about that. Now, at least there's now starting, the state is to pay its share. Mm-hmm. You know what I mean? To pay its proportion to keep the debt from growing. Any sense that that's likely to go anywhere?
Well, we had Governor Wolf in for an editorial board meeting back at the beginning of March. He says he's willing to sign whatever the heck it is the legislature manages to send him something, anything. He'll sign it. They came within a hair's breadth last session, 3 votes in the House, and the Democrats all looked up and said, "Wait, this affects us," and then they decided not to vote for it. But it's a so-called stacked hybrid plan that would be kind of a pension, kind of a 401k, and it looks like that's what they're talking about again. But we got to see a bill starting to move.
But there's also arguments, Karen, that really doesn't make a difference in the pension debt in the long run.
I think it depends which plan you're talking about. Over the past few years, we've had, a number of proposals, some considered very seriously, some just thrown out there. I think that, one thing we would hear if this is pushed forward this session is about how it, probably whatever it is would not help this year's budget, which is going to be a big enough problem, but it would be, pitched as a long-term problem that they might try to, solve.
All right. I want a great update. Thanks for coming in. All right. We have a healthcare update that you're not going to want to miss. We're going to get into a couple of subjects that affect you, the consumer of healthcare. All of us will do that in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
All right, when you go into a doctor's office, you always see a nurse. Well, what is the relationship between a nurse practitioner and a doctor? Who can do what, and what does that mean to you, the patient? We got an expert in the house that's going to help us, Dr. Charles Cutler. He's the president of the Pennsylvania Medical Society. And I love to have doctors on because you're in the real world, you know what I mean? You're not theorizing anymore about. So answer this for me, doctor. You've got a nurse practitioners, and sometimes more than one, depending on what's going on, and then you have the physician, and that relationship, who can do what and under what circumstances, really does matter, doesn't it?
Terry, it really does. The Pennsylvania Medical Society has been advocating for a continuation of those collaborative arrangements. They are defined by contract. And ahead of time, the physicians and the nurses talk about how patient care in a given office or in the hospital will run, communication. A patient may see a nurse, but behind the scenes, there's a doctor helping out, helping the nurse when the patient care becomes complicated, when things aren't going straight. Then the doctor comes into play.
Sure.
Unfortunately.
And there's certain things that nurses do, and then there's certain things that only doctors can do, right, and that doctors should do based on, obviously, their experience and their training.
Yeah, so let's talk about training. A nurse practitioner may have hundreds of hours of clinical training, but a physician may have 12, 15, even 20,000 hours of clinical training through 4 years of medical school, 3, 4, maybe 5 years of residency. So the amount of training is very, very different. The experience and the knowledge base that a physician carries with him or her is very different than a nurse practitioner.
Now, when you talk about a collaborative agreement, obviously that's what we really are talking about, a collaboration between the two. They're a team. Is that a legal entity, a collaborative agreement?
Yes,
Go ahead.
yes, there is a document. And these documents do get looked at by the state of Pennsylvania. So there is a formal relationship between the doctor and the nurse practitioner. And it's a good relationship. It's been in existence for years. And there are now lobbying folks that want to change that. They want to do away with the collaborative agreement. And we oppose it. The Pennsylvania Medical Society feels that there's a safety issue. Doctors and nurses are not interchangeable. They do different things. And the physician oversight that exists with the collaborative agreement is an important safety mechanism for our patients.
Yeah. Now, I guess if the collaborative agreements remain in effect, will that cause any kind of disruption to the medical system? I mean, are the nurse practitioners going to, one argument is that they could move to rural areas. Is there any truth to that?
Well, we've looked at what's happened in other states that have done away with collaborative arrangements, agreements, and in fact, those states have the same problems with access that Pennsylvania does. People, by and large, want to live in urban areas where there are educational opportunities, social opportunities that just don't exist in the rural areas. So we could allow nurses to practice independently, but our research shows that they will stay in the urban areas.
The nurses will stay, and we do have something that I've talked about with your predecessors, past presidents, about the shortage of physicians in rural areas, and I don't know to what extent that remains a serious problem. Maybe that's something we can talk about in the future. But what's your sense about that?
It is a problem. What we call workforce is something that the Pennsylvania Medical Society looks at all the time. Now, fortunately, broadband internet has spread throughout the state, so telemedicine is expanding, and there are opportunities for physicians in urban areas to actually reach out and help patients in the very rural areas through telemedicine. And I think we're going to see an expansion of that as the years go by.
Yeah, that's a good point. Now, you've had a study done about these collaborative agreements. What's the bottom line there?
Yeah, 80% of the folks that we surveyed say that the collaborative arrangements should continue. There's a small percent, perhaps 12 or 13%, that just aren't sure, they don't understand, but only 5%, 1 out of 20 Pennsylvanians say that those collaborative agreements should go away. So we think the citizens of Pennsylvania are behind us on this effort.
Yeah, this is an important subject. I mean, that relationship has to work. I mean, it has to work, and as you point out, be collaborative, and the roles have to be clearly spelled out, or you're going to get something that no one wants, confusion in the medical system. We're going to run to a break, and we come back. I want to talk about testing, what you have to do with certain tests and how they get done, and whether there needs to be pre-authorization from insurance companies, and how that situation stands in our state. We'll be back with Dr. Cutler, and we'll get into that subject in a moment.
This broadcast of Pennsylvania Newsmakers is brought to you by the Pennsylvania Medical Society. Inspired physicians committed to the good health of Pennsylvanians and the advancement of the practice of medicine. And by the Pennsylvania Healthcare Association, advancing quality, improving lives.
All right, another important potential problem is the insurance companies are now insisting on prior authorization before you can have a multitude of tests. It used to be a small number, now it's growing. What's the pros and cons to all of that?
Terry, let's give the insurance industry the benefit of the doubt. 15 or 20 years ago, when they first initiated this program, they were looking at a few very high-priced tests that were eating up the healthcare dollar. And in order to save money, they created this program where before one of those high-priced tests could be done, the insurance company had to approve it. No problem. The medical society went along with it. Mm-hmm. But over the years, more and more tests have been added, more and more procedures have been added, medications have been added. So now the physicians that are trying to help patients are actually being hampered by the insurance company and by this demand to have tests, procedures, medications authorized before the patients can have.
Would you argue that many
done.
of the tests that they want pre-authorization or medications are fairly routine? Is that your point?
Yes,
They're
they
routine,
are routine tests. In terms of medication, sometimes patients, and I know this as a primary care doctor, patients have been on a medication for a long time, and suddenly the insurance company looks at the medication and says, no, you can't be on that medication. If you want to stay on it, the doctor has to call in and justify it. It's a huge waste of time.
So what you're talking about here is increasing the workload on a physician. So instead of, your argument would be, instead of seeing patients, you're spending your time on what you would consider to be routine. Go ahead.
Two things. First of all, yes, it takes a lot of physician time. The doctor has to call 1-800, find somebody, push one, push two, finally get somebody from the insurance side on the phone. Often the insurance companies haven't even looked at the medical record. They just routinely deny it. But another part of it, Terry, I just want to make clear, in our office, we have to hire a full-time person just to work on pre-authorization. Okay. So a large amount of healthcare dollars are going to administrative side of things when they could go to patient care, and we think that's wrong.
All right. Well, I want to thank you for coming in. So obviously, the Pennsylvania Medical Society thinks this is a fairly substantial problem. I want to thank you for coming in, and we'll see you next week for another edition of Pennsylvania Newsmakers. And as always, stay well.